me rough, beat it up, turn me backwards, make us scream louder.
Welcome, Ghana. I'm your host, Kati G, and this is Steamy Nights, where we share our sexual experiences and advice. This program is proudly brought to you by Comets Properties Limited and supported by Malcolm, Where Ghana Shops, and Ajua Otua's Clothing. Now, the topic that we are going to be discussing tonight is, what is a pap smear? Do you know what it is? Don't worry, we'll let you know what it is. But before we dig into the topic, we need to get to know who our experts and advisors are. So let's get to know who they are now. Segze.
Hi all, my name is Segze. I'm Ghanaian, of Ghanaian heritage, born and bred, and let's have a good day.
Ajua.
Hello, I'm Ajua Mwakwa, a realtor and a business developer.
Erica.
Hey everyone, I am Erica Daniel and I am an intimacy coach.
Dr. Appiah Kubi.
Hi, I'm Appiah Kubi. I'm an obstetrician gynecologist. It's a pleasure to be here.
All right. Okay, so remember, viewers, hashtag Steamy Nights. Get on Twitter, Facebook, and Instagram, and let us know what you know about the topic, how you feel about the topic. Give us your comments.
Me rough, beat it up, turn me backwards, make us scream louder.
Comet Properties is the premier private city developer in Ghana, providing quality homes and transforming virgin lands into modern cities within the best neighborhoods. Get to Comet for secured and developed allotments or functional homes built for your quality lifestyle. To purchase land or your next home, follow us on Facebook and Instagram at Comet Properties or call us on 020-822-6359. Comet Properties, transforming virgin lands into modern cities.
Me rough, beat it up, turn me backwards, make us scream louder.
Let's get started. All right, so tell us, what do you know about what a pap smear is? Segze.
What I know is that it's an examination on the cervix of the female, occasionally ongoing, to determine if there are any abnormal cells just before entrance into the womb on the cervix.
Okay, Ajua, here's a question for you. What do you know about pap smear? Is it performed on men or women?
Okay. Hi, I know pap smear is performed on women, most especially women from the ages between 21 upwards, I think. And I know it's usually done in the lab where substances, let me put it that way, in and around the cervix is collected, probably using a brush, and then studied under microscope to, decide if there is a problem with the women's cervix, which can probably lead to cervical cancer and other cancerous diseases. Thank you.
Erica, what do you know about pap smears?
That they can be uncomfortable.
Doctor, we're not going to get to you yet, because we know you know a whole lot.
Very uncomfortable and shy.
So we want you to get a gist of what we understand about the pap smear before you break it down to us, okay? So, Erica, do you think it's necessary for us to get pap smears?
Not for us, for women.
Okay.
And yes, it is very necessary because it can tell you a lot about what is going on within your reproductive system. So it's definitely an examination that women should prioritize.
Okay. So, Segze, have you ever witnessed a pap smear or have gone along with your partner to get a pap smear?
Yes, I mean, most females definitely need a husband's support when they are going. It's a very uncomfortable and frightening scenario, especially when results come You know, it is a frightening experience for the ladies, and I take my heart out that you are very, very brave.
Can you describe how frightening it can be?
Well, I mean, in my experience, the ladies that I've taken for support are very anxious, and no matter how many times they go, the minute they have to go, it is emotionally disturbing, and it is, you don't know the outcome, what is going to come up.
Okay.
Yes, it's a serious thing. It's sad. So I always support and go with them for that. I might not go for anything, but that in particular, if a woman requests it, that you are close to, maybe friend or wife, you should go and give support. But it's not a simple thing.
Okay.
It's like what do you call that one that they test our prostate where the doctor puts his finger up my
Really?
ass? Yeah, that's another troublesome thing. But I go and my wife goes with me because I'm scared.
Right. Now,
so-
Appiah, do you support what Sekze is saying, that it's a frightening thing to go through? But have you had a pap smear before?
Never before.
Never before. So do you consider it, from what you've heard about it, do you consider it to be frightening?
Yes, because I spoke to a doctor friend of mine, and then he told me how it's done and all. And usually I have a problem with, stuff entering aside the right to. What do I mean by right to? I mean, aside penis, I don't feel comfortable with any other thing entering my vagina. Because usually when I have infection and I go to the hospital, let me confess, when I'm given any, treatment that I'm supposed to, push inside my vagina, I don't do it at all. Usually I'm comfortable with taking antibiotics, I mean orally.
But
if you give me anything to stick inside my vagina,
do you
never.
consult with a doctor, when you have infections? Or do you just go
That's
over
why I
the
said when I
counter?
go to the hospital and I'm given a prescription that has to do with something I have to push inside my vagina, I don't use it.
Okay.
I end up going to a pharmacy to, request for something I can take orally.
Okay.
Because I'm not comfortable with stuff entering my vagina, except penis.
Okay.
Yeah, that's for sure. I must be frank.
And not everyone, just one. Just one penis.
I mean, the
One
right thing.
koti, in Ghana as they say, koti kesiye.
Not really.
Describe
the
that
case.
to those that don't speak Tree.
Well, koti kesiye, it means a big willy, that's all.
So,
That will give you an infection. Some of them are too big, the woman collapse and get infections all over them because you scraping all the innards of the woman, the poor woman, and then they get infection.
So, Erica, what is your response to being frightened, about the procedure?
For a first-time woman who's getting a pap smear, what I would say is it's not something to be frightened about. Instead, it's something that if you have the right medical provider, it is something that they will make you comfortable with, and it's a procedure you can ease into with ease. When I say it's uncomfortable, I mean it is rather exposing. But often I feel lucky that I've had medical providers who've allowed me to feel very comfortable in their presence, with a nurse also in the room, and they take a lot of care before continuing with the examination.
So, Appiah, are you convinced by what Erica is saying, that it's
Not yet.
not yet?
Yeah, I mean, I've been living with this for the past 27 years, so I don't know how I'm going to get it done anyway.
When you go to
maybe
when you go to the thing, do they give you the right support and the kindness and patience to get it done, or you just
even
don't want to
with
go?
just using, let's say, pushing in something more like a pill, because I probably have candidiasis. I can't even do it. How much more someone trying to scrape off something off my cervix?
Okay.
So I don't think I'll ever become.
So, Doctor, I hope you're listening to all of this.
Yes, I am.
And we will be right back. We're going to take a commercial break, so save all your questions and response. Just letting our viewers know that, look, hashtag Steamy Nights. Go to Twitter, Facebook, and Instagram. Let us know what you know about what a pap smear is. Have you had one before? What was your experience having one? And we will be right back.
Steamy rough, beat it up, turn me backwards, make us scream louder. Steamy.
Welcome back to Steamy Nights, where we share our sexual experiences and advice. Before we get back into our topic, we need to let you know who our sponsors are. Comet Properties Limited is a premier private city developer in Ghana, providing quality homes and transforming virgin lands into modern cities within a good neighborhood for your quality lifestyle. Get to Comet for secured and developed plots of lands or for functional homes built for your quality lifestyle. Comet Properties, transforming virgin lands into modern cities. Now, while we are talking about sexual experiences, we are enjoying our conversation on lovely, comfortable furniture, proudly provided by Melcom. Melcom is where the nation shops. You can find all your appliances, furnitures, furnishings, household goods, food supplies, and more at very cool, excellent prices. Find everything you need for your lifestyle needs at Melcom. Melcom, where Ghana shops.
Steamy rough, beat it up, turn me backwards, make us scream louder.
Comet Properties is the premier private city developer in Ghana, providing quality homes and transforming virgin lands into modern cities within the best neighborhoods. Get to Comet for secured and developed allotments or functional homes built for your quality lifestyle. To purchase land or your next home, follow us on Facebook and Instagram at Comet Properties or call us on 020-822-6359. Comet Properties, transforming virgin lands into modern cities.
Steamy rough, beat it up, turn me backwards, make us scream louder.
Now, back to the topic. Viewers, we have an obstetrician and gynecologist doctor here on set. Dr. Appiah Kubi.
Hi.
How are you doing?
I'm fine. How are you doing?
Oh, doing great. So, based on your observations and what you've heard, what do you think about what they've been saying?
Well, it's been a very interesting discussion. I mean, listening to the comments so far has been rather interesting. It's what has struck me a lot is the fact that there are some who will be afraid of the procedure. But I think I'd like to just reassure most of all of us that even though it may sound quite daunting to go and have the procedure done, it's really not something that you need to be afraid of. And it is, you can't describe it as a life-saving procedure when you consider the downsides of not getting it done. Assuming you don't get it done and you end up with the consequences of cervical cancer, that can be quite devastating.
So tell us, what is a pap smear?
So a pap smear is a procedure. It's a very simple procedure in which we take samples or cells from the cervix to the lab to see whether there are any changes taking place on the cervix. We do that in order to prevent cervical cancer because we know that there are some lesions that you can get before you actually get cervical cancer. These are what we call the precancerous lesions. So the idea is to pick up these precancerous lesions before they become cancerous so that you can treat those lesions. And those lesions can be treated 100%. Once we detect those lesions, you can treat it 100%, as opposed to having a cancer where it is difficult to treat.
So why do most women don't know about pap smears?
I think it has a lot to do with our inability to maybe communicate the seriousness of the condition. I think that it has a lot to do with education. There's a lot of work that has to be done as far as educating our women, right from the school age all the way to our adults, for them to know the benefits of having the procedure done, because it is quite beneficial. Yeah.
When's the best age to get a pap smear?
So it's recommended that pap smears are done from the age of 21 all the way up to the age of 65.
If you are sexually active or before?
Once you're sexually active, we advise that you get a pap smear done.
What about when you're not?
If you're not sexually active, then it's not likely. So we know that getting cervical cancer is a sexually transmitted disease. You can get cervical cancer once you come into contact with a virus that we call human papilloma virus, and that is usually sexually transmitted. There's a very, very tiny percentage of people who can get this HPV without having sex. And in that instance, you may need to do what we call a HPV DNA, do a DNA test. But usually, you'll get this virus once you are sexually active.
When you say sexually active, define.
Once you've had sex before, just one episode.
Just sex?
Just sex.
No other type of sexual
yes.
activity?
Can we be specific?
Yes.
Is it penis, penetration, fingers,
Yeah.
toys?
Usually penis, but I wouldn't exclude any of the other types of sexual encounters.
So, Doc, so what about if you had 3 partners
Yeah.
and none of us men carry the papilloma virus, as you say? Would the woman be okay to do with cervix? Because I know my missus had that, she had the cervix frozen. That's a treatment
Right,
to
yeah.
start off with, yeah.
Sure.
Because she was oozing some pink thing.
Yes, yes.
So that means, I don't know, she was not a virgin when I met her.
Right.
She wasn't a virgin. So, but then she had it. And so
Yes.
you are saying is that her partners along the line
Yes.
had that virus, that papilloma thing.
Yes.
And we've given it to her.
Yes. So all it takes is just
Wow.
one episode. And the thing about cervical cancer on its own is that it's a very patient disease because it takes about 25 years before it actually, from having the infection from sex to actual full-blown cervical cancer.
Wow.
So that's a long time.
I never knew that.
And that's why it's very easy to have the pap smear done to prevent you from having cervical cancer. It's very unfortunate. I mean, when you see patients come in with cervical cancer, it can be quite,
I know.
difficult, And majority of the time, most of them come in and the narrative is that they haven't had a pap smear done before,
So how do you respond to those that fear getting a pap smear done? Especially Ajua, she has fear
Yes.
in getting it done. How do you respond to it?
Yes, I think Ajua will have to work on her. So I think these are things that we'll have to work on in the consulting room just to get them to relax and know that it's not something that is going to harm them. We always take our time and we're very gentle when we're doing the procedure in such a way that it is not painful. Usually I tell most of my patients that you may feel some discomfort, but not necessarily pain. And if it is getting painful, they always need to let us know so that we take our time,
Can it be done under anesthetic?
Oh,
Small and the injection into the thing and then just do your thing.
be too relaxed.
So there's nothing, no feeling at all. It will help, Doc. They see.
Well, that's
Or you are not allowed to do that in that procedure. You don't want
that's a bit extreme.
extreme to put. Yeah, okay,
It's
I
not
get you, Doc.
always necessary to do that. Even though I know where you're coming from.
Yes, the fear. Somebody is fearful. Yeah.
Yeah, I know where you're coming from, but it's not always necessary to have that
Okay.
done.
So Ajua, tell us what your fears are. What do you fear? Like describe. Like you fear the instrument going into your body, or what do you fear? Based on what you know.
Okay, right. So I think I have a small vagina. That is what I think. Because anytime I'm making out with my man and, he tries taking his finger into my pussy, it's a bit painful. So I'm just imagining a whole tool entering my vagina. So I have the fear of, maybe ending up collapsing or something, passing out and not waking
You're already laying down, so it's fine.
Right. Of course, because there are times that during sex
I'm very
I feel
proud of
I'm
you.
going out, and I go like, hey, I'm going blackout. Not because I've not eaten or anything, because probably me, it's
bless
too
your
painful.
soul.
Because it can't always be pleasant. Sometimes it
Yeah.
has to be painful. So
Very small matter.
that's what I feel.
So,
That's my fear.
Happiness is a tight pussy.
Erica, may I ask, have you had the procedure done before?
Yes.
Do you mind describing it to our viewers?
No, I don't mind at all. And I think one thing I would add for anyone in Adjoa's position who hasn't had it done before is when you finally go for the first time, make sure you communicate with the doctor that it's your first pap smear. Because I do think doctors take exceptional care to make sure you're extra comfortable and really explain every step to you. So as someone who goes for a pap smear, one thing that you can expect is you will have to undress from the waist down. I have some doctors who've asked me to fully undress because they also perform a breast exam to make sure that there aren't any lumps that are also forming within my chest. So it's a full kind of female examination and procedure. And so once you are undressed from the waist down, you will be laying down on a table and you'll be asked to put your legs into stirrups or into something that elevates it a bit. And once the doctor comes in, you're fully covered. So there's something covering you so that you don't feel that your legs are just exposed to the world. And for some reason, it always feels like when you're in a doctor's office or a clinic, your legs are facing a window.
Steamy rough, beat it up, turn me backwards, make us scream louder.
Comet Properties is the premier private city developer in Ghana, providing quality homes and transforming virgin lands into modern cities within the best neighborhoods. Get to Comet for secured and developed allotments or functional homes built for your quality lifestyle. To purchase land or your next home, follow us on Facebook and Instagram at Comet Properties or call us on 020-822-6359. Comet Properties, transforming virgin lands into modern cities.
Steamy rough, beat it up, turn me backwards, make us scream louder.
But don't worry, it's always covered. You can't see outside or anything like that. So the doctor will come and he will always speak with you first, or she will always speak with you, make you comfortable, letting you know what to expect. For someone who feels they have a smaller vagina, you can request a smaller speculum. Exactly. So for me, myself, I use one that they tend to use on teenagers and also on virgins as well, because I have a smaller canal than most women my age. Your canal size can also change with childbirth and different things like that. So don't be afraid to ask for something that you think you may need. And during the procedure, the speculum is often lubricated as well. And your doctor will almost coach you through your breathing, because if there is fear, if there is anxiety, your body tightens, your muscles tighten, so you clench. And that's when you can start to really feel pressure, because everything in you is pushing down on what is trying to enter, which means you're not comfortable. Your doctor will often notice that and just guide you through some breath and say, you know, it's okay, relax, and maybe even try a couple of times. They will never force the speculum inside of you. Once the speculum is in, sometimes you just do a quick tightening, and it's probably like a 5 to 10 second procedure of a quick swipe. You don't really feel it, and then they pull the speculum out and you're done. So in total, from the time of getting on the bed, the doctor coming in, you're probably only under the examination for maybe 5 minutes. And most of that is just the doctor making you comfortable. So those have been my personal experiences in Ghana, outside of Ghana, male and female providers. And so for me, it's just always uncomfortable being like, my legs are wide open and there's somebody whose face is just right there.
And to add on, you can have a female.
Get it done,
You can, and I've had some
If you feel
really,
more comfortable with
really
Catherine
good
in the
female
procedure.
providers here.
So, may I ask, at what age did you take a pap smear test?
So I am American, and in the U.S., when I was growing up, it was almost like a rite of passage. On your 18th birthday, you would go in for your first pap smear. And so I remember when I turned 18 being like, I don't want to go. And my mother's like, you get to miss school. And I was like, no, today I want to stay at school. But my doctor was a female. She was someone I had actually been shadowing because I thought I was going to go to medical school. And so it ended up being a really seamless and positive experience. But for us at that time, it was from age 18, and it was an annual examination.
Okay.
Erica, did you say you got it at the age of 18?
18.
In America, you have to. There is no choice.
I think the doctor said it usually starts at the age of 21. That's what I also read.
So back then, maybe it was earlier, but also in the States, it's almost like a rite of passage.
Yes.
How often do you need to take a pap smear?
So ideally, every 3 years. Every 3 years, you need to get a pap smear done.
That's you know what? When I was growing up, I was told every year. But then I also heard that I grew up in the States.
Right.
And I was told every year. But
Right.
then when I went to a gynecologist in Ghana,
Right.
he explained to me that because he had also he also practices in the States. He explained to me that for us in the States, we're told that because back then when like HIV was on the rise,
Yeah.
they were trying to look for ladies that had cervical cancer because of HIV. I don't know if I'm wrong, but I'm asking you.
Yeah.
If
So
I-
over the years, things have the guidelines have tended to change a little, and we expect that. I mean, medicine is an evolving field. I know that in the past years, I mean, we used to do 18 years, and it also depends on the country you're in. In the UK, things change compared to what you probably experience in the US. But when you look at the current guidelines, majority of the guidelines talk about 3 years and starting at age of 21. Because, like I said, these are changes that will take place on the cervix. The changes that are taking place take place at a very slow rate. If you look at the first debut sexual encounter, after the first encounter, you may not pick up much at the age of 18. So if you look at the public health benefits in terms of costs, are you really going to pick up anything at the age of 18 or maybe 19 or 20? But you find that a lot of the time you may start picking up some of these lesions from the age of 21 rather than earlier on. So these are things that have, with time, things have evolved.
Okay, well, this is very good information for us all. We will be right back. And remember, viewers, hashtag Steamy Nights, Facebook, Twitter, and Instagram. Let us know what you know about pap smears. Ask questions, leave comments. Let's talk about this because it's very important for a woman, and her life. We'll be right back.
Steamy rough, beat it up, turn me backwards, make us scream louder.
Welcome back, everybody. This is Steamy Nights. I am Kati G, and we have to wrap up the conversation. But before we do, we need to acknowledge our sponsors. Comet Properties is the premier private city developer in Ghana, providing quality homes and transforming virgin lands into modern cities within a good neighborhood for your quality lifestyle. Get to Comet for secure developed plots of lands or for functional homes built for your quality lifestyle. Comet Properties, transforming virgin lands into modern cities. Now, while we are talking about sexual experiences and giving you advice, we are enjoying our conversation on comfortable furniture, proudly provided by Malcolm. Malcolm is where the nation shops. You can find all your appliances, furniture, furnishings, household goods, food supplies, and more at very cool prices. Find everything you need for your lifestyle needs at Malcolm. Remember, Malcolm, where Ghana shops.
Steamy rough, beat it up, turn me backwards, make us scream louder.
Comet Properties is the premier private city developer in Ghana, providing quality homes and transforming virgin lands into modern cities within the best neighborhoods. Get to Comet for secured and developed allotments or functional homes built for your quality lifestyle. To purchase land or your next home, follow us on Facebook and Instagram at Comet Properties or call us on 020-822-6359. Comet Properties, transforming virgin lands into modern cities.
Steamy rough, beat it up, turn me backwards, make us scream louder.
Now, let's talk to you, doctor.
Yeah.
So, a quick question. Why is it that we are in Ghana?
Right.
We're filming from Ghana.
Right.
Most of our viewers are from Ghana. Why is it that most Ghanaian women do not have or know about pap smears?
Part of the problem is policy. I think that we need to change our policy in terms of who should have a pap smear done, when it should be done. And I think we also, as providers, also need to change what we're using to take the pap smears. There are different methods. We need to look at what is cost effective, because the truth is that doing a pap smear can be quite expensive for the average Ghanaian. So one of the problems also, apart from policy, is cost.
How much does a pap smear cost?
So pap smear would cost anything between 50 to 200, 300 Ghana cedis. When you look through the length and breadth of this country, not every Ghanaian woman would be able to afford that. And we need to get every Ghanaian woman to do a pap smear if we're going to eradicate cervical cancer. There are other methods of detecting these precancerous lesions. Apart from doing the traditional pap smear, we have what we call a VIA, where we paint the cervix with acetic acid, and that is more cost effective. And I think that is something that if we target some of the less endowed communities, we would be able to achieve some success.
Okay.
Right.
Adjoa, so do you feel more comfortable? Are you interested in going for a pap smear finally?
I've not decided yet. Maybe I would have to witness one and see if I can.
Doctor, can you convince her right now on the sets? And then also for the viewers that are just like Adjoa.
Yes, I think we'll have to get Adjoa in and let her have a procedure done.
What can you say to her now that can convince her, or try to convince her?
Oh, I think we'll have to disabuse your mind that it's painful. The first thing is that it's not
That's
not
what
as
I want to
painful.
hear.
It's not that painful. So and I think that we'll try and get it done in a way that will be as comfortable for you as possible, so that you enjoy the experience.
So
Yes.
how long does the pain last?
Like I said, there's not much pain. Okay, it's not a painful procedure. You may feel some discomfort because of the fact that we are inserting an instrument into your vagina, so you may feel a little bit of discomfort. And like she said, we usually lubricate the instrument just so that it would improve your comfort during the procedure.
Okay.
So you'll be in very good hands. So I'm waiting for you to come over so that we can do it for you.
Yours is easy, Paul. What me, every year I go and the doctor look at his fingers there. The last time I had one, a Nigerian, he stuck it up my ass and was feeling my
Your balls.
No, just the prostrates to make sure, and it's the most effective way of detecting prostate cancer.
Yeah,
but now,
it's
doc,
delicious.
we hear we can take what is the blood test determines the pH level.
PSA.
So you don't do that anymore. The fingering.
It's still done.
It's still done.
It's
Ain't no
still
thing.
done.
So if you do me a blood test and it shows that my pH balance, would you finally have to stick your fingers up my bum?
So the whole idea. Well, I don't want to speak for the urologist, but usually you want to get a full clinical picture. So in addition to your laboratory investigations, you're also going to do
Traditional
your
method will be used.
clinical examination. Just so
Very
that you
enjoyable.
get-
Segze, since you are very supportive of your partner, how can you advise the viewers about supporting their partners to go for a pap smear?
Or basically, please do. You know, you must do. There's no excuse at all.
Look at this camera there. Talk to them.
Again?
Yeah.
Well, yeah. My fellow Ghanaians, please support your ladies and take them to the place. So, because, Charlie, if your wife is sick, you will suffer. Well.
Why should they support them?
Because it's your wife. It's your wife. I mean, if she cannot go to work because she's oozing, you know, all kinds of things from her private parts, then, you know, you're losing half of your income. Because in Ghana, you know, it's a free country where women and men work. They have to work. They don't depend on men anymore. Very independent. We all are, and that's what we've chosen in this country. So you have to find time off and take her for support if she asks.
And Erica, based on your experience, what can you tell other ladies preparing themselves for the test?
Okay, so when it comes to preparing yourself for the test, what I would say is just know it's something for your good and for your benefit. It's quick, it's easy, and it's really important if you're taking care of your whole health. And so know that there's no harm that will come your way, but it can be very informative.
All right. So I guess we're all good here. Thank you so much, Doctor, for coming and educating us.
Yes.
You know, it's very important. We're even happy, Sex Day, you're here because men need to know, you know, in order to push and support their ladies, you know. And thank you, Adjoa, for coming because you represent a lot of Ghanaian women or young ladies that haven't gone for it, that really need to go for it, and, you know, that need to conquer their fear and just go for it because their health is very important. And thank you, Erica, for allowing these women that are watching to know the experience and to know that they do not have to fear getting it done. So, hey everyone, remember you are watching Steamy Nights, where we share our sexual experiences and advice. Remember, hashtag Steamy Nights, Facebook, Twitter, and Instagram. Go there, comment. Let us know what you know about pap smears, if you've gotten it done. If you want to get it done, reach out to us. And we'll talk about it. We'll let you know where to go. And remember, I am your host, Kati G, and see you on the next show.
Steamy rough, beat it up, turn me backwards, make us scream louder.